Standard glaucoma surgery has so many complications and so many hidden risks, and we in the glaucoma field have been looking for decades for a better procedure that can expose the patient to less complications, and this may be the answer.
It is an amazing technology, very user-friendly, and I was impressed with the results actually, the studies, and also there has been up to 7 years follow-up. The results are impressive.
If we're taking someone in for a cataract procedure and and they're on many different glaucoma medications, many patients are very interested and motivated to try to get off of them. And not only from a quality of life standpoint, from a financial standpoint for them.
I enjoyed the Trabectome because it was the ease of use. It was, I can't think of another word other than elegant. You put the probe in the eye, you identified the landmarks, you made a sweep into TM, into Schlemm's canal, you make a sweep, 2 sides and you're done. It was really quite easy.
Trabectome has been approved to be able to do with any kind of glaucoma. So my patient selection for Trabectome encompasses what I can do for iStent, but in addition to that, I can do it as a standalone procedure in patients who are phakic or pseudophakic. The kind of array of patients that I can do for Trabectome is wider than it is for iStent. Sometimes with Trabectome I've done some cases where it's very typical and patients' pressures are in the 40s on maximal medical therapy, and I've been able to get them down to 1 or no meds. I have not done those kind of cases with the iStent.
I've done over 200 Trabectomes. I have a big glaucoma practice. I do a fair number of cataracts, and this procedure just marries with cataract surgery so well. You're right there, it's at the same time, it adds an extra 5 minutes. I say to my patients a lot of times, hey, what if I could do a procedure at the time of your cataract that's covered by your insurance, that'll take me 5 extra minutes, that will probably get you off at least 1, maybe both of those drops. What if I could do that at the same time? Would that interest you? And it virtually interests everybody.
Surgically, it's a very elegant operation. It's easy to do. Anyone can do it with a bit of practice, and it works. And I think that speaks volumes for the science behind the operation.
But once you see good pressure responses, it's a huge eye-opener, and there's nothing as gratifying as having a colleague assess a patient and talk about this cataract surgery that had such a great pressure response, because they don't realize that you performed the combined procedure because it's so supple. You don't see a bleb, you don't see hardware. It's a hidden surgery. Just recently I referred someone to a colleague in Las Vegas, and the patient didn't recall what she had done. She said she had cataract surgery done, but her pressure was in the lower teens, and it was before in her 30s. And that doctor was puzzled why I had performed a cataract surgery that had such a great response. And I said, well, didn't you do a gonioscopy? Didn't you see that she had a trabectome done? And it makes me chuckle. I'm very pleased because this is good for the eye. You could not tell by looking at the eye without using a gonio lens, for instance, that something so powerful had been performed.